Good morning, students. Today we discuss the humerus bone. This is a humerus bone. Humerus. It is a type of bone is long bone. So long bone having the upper end. This is the lower end. This part is the lower end. This part is the upper end. Between these two parts is the shaft. So long bone having the upper end, lower end, shaft. So it is a long bone. Next, superiorly it is going to articulate with the scapula to form a shoulder joint. Inferiorly this lower end articulates with the radius and ulna to form a elbow joint. Elbow joints. Next, another one, it having the three borders and three surfaces are there. See here, this is the anterior border. It started from the greater tuberosity. See here, this extends up to this is the anterior border. Next, this is the medial border. This is the medial border. See here, this is the medial border up to the medial epicondyle. Next, this is the lateral border. So inferiorly lateral border is more sharp from here and reach to up to the posterior border of this greater tuberosity. So automatically these three borders, anterior border, lateral border, medial border and lateral border divides into sharp three surfaces. This is the anteromedial surface. This is the anteromedial surface. It is present between the anterior border and medial border. This is the medial border. This is the anteromedial surface. Next, anterolateral surface. This is the anterolateral surface between the anterior border and lateral border. This is the anterolateral surface. Next, whereas here this is the posterior surface. It is present between the medial border as well as the lateral border. This is the posterior surface of the shaft. So three borders: anterior border, medial border, this is the lateral border. This is the anterior medial surface, this is the anterolateral surface, these are the posterior surfaces are there. Now you know upper end is there, lower end, shaft having the three borders, three surfaces. Next, parts. What are the parts of the upper end? See here, mainly upper end having this is the head. This is the head of the humerus. This is the anatomical neck of the humerus. This is the lesser tuberosity. This is the lesser tubercle. This is the greater tubercles. This is the intertubercular sulcus. It is also called the bicipital groove. Here constricted part is there. This is called the surgical neck of the humerus. This is upper end. Next, lower end having, see, mainly it is expanded part. It is having the, see, medial to lateral side, medial epicondyle. This is called the medial epicondyle. This is the trochlear surface. This is called the trochlear surface or the pulley shape, and this rounded is there, that is called the capitulum. This capitulum going to articulate with the head of the radius, trochlear surface going to articulate with the ulna, and this is the lateral epicondyle. So lateral epicondyle, capitulum, trochlear surface, medial epicondyle, and also this lower end having the here two fossas are there, like a when the elbow joint, when the flexed, here we can identify the capitulum above, one small fossa is there. This is called the small fossa, radial fossa. And above this ulna, here ulnar fossa is there. Here coronoid process going to articulates when the elbow joint become a flexed. Whereas posterior surface of this lower end, there is a big like a fossa or the whole type it is there. This is called the olecranon fossa. Olecranon fossa always posteriorly. Now you know the parts of the lower end, parts of the upper end and parts of the shaft you know. So finally how to hold in anatomical position and side determination. See, always this head is keeping towards the medial side. Toward the middle side. This is a lesser tubercle always facing anteriorly. Whereas the lower end medial epicondyle always facing medial side, and posteriorly olecranon fossa facing posterior side. So if I am keeping the right side, example, head is facing towards the lateral side, so it is not matching. And posterior surface is okay, it is matching, but head is not matching. If I am keeping like this, what happens? Head is facing towards the medial side, it is matching, but olecranon fossa, it is not matching. Olecranon fossa facing anteriorly, so it is not belongs to the right side. Now, if I am keeping the left side, head is facing towards the medial side, it is going to articulate with the scapula. It is matching. Anteriorly it is facing, this is a lesser tubercle. Okay, it is matching. Middle epicondyle is present middle side, and posteriorly olecranon fossa is there. So it is belongs to the left side. So these are the character features to identify in the right or left side determination of the humerus. So actually it is belongs to the left side, not right side. So anatomical position, hold always keeping upper end, head is upwards, expanded part always lower part, olecranon fossa always keeping posteriorly, hold like this. So always keeping vertically, so it is belongs to the left side. So like this. This is the anatomical position and side determination left side. Thank you.